Good morning, everyone. Welcome. We will get started right at 10 o'clock. Give everyone a moment to trickle in from the waiting room. All right, 10 o'clock is upon us. Welcome, everyone. Thank you so much for being here for today's webinar, Supporting Infant Mental Health, Applying the Safe Babies Approach to Strengthen Families and Early Childhood Systems. Groundwork Ohio is excited to bring you to this webinar today and to share a free social work CEU opportunity if that's what brings you here. If you're not familiar with us, my name is Caitlin Feasby. I'm the Senior Director of Policy with Groundwork Ohio. And if you're new to our work, this is just a little bit about us. We're a committed, nonpartisan public policy, research, and advocacy organization focused on the early years of life from the prenatal period to age 5. We work to ensure that every child has access to high quality early learning and healthy development strategies that lay a strong foundation for Ohio's kids, families, and communities. There's a lot of ways that we do this, but including and not limited to mobilizing broad coalitions of families and business leaders, policymakers, community partners around solutions that are evidence-based and data-driven. Just a couple quick housekeeping things. Today's webinar will be recorded and will be posted on our YouTube channel. If you need closed captioning, that is available through Zoom. You can turn that on your end. All participants are muted. We ask that you please use the Q&A feature for questions. Feel free to include your email address with your questions. If we're not able to get to everyone, we'd be happy to follow up afterward. All participants will receive a recording of the webinar. And finally, if you are here for a free social work CEU, you must stay for the entirety of today's presentation and complete the evaluation at the end, and a copy of the certificate of completion will be emailed to you after the webinar. Without further ado, it's my pleasure to introduce our speakers, starting first with Judy Norris, who is a Senior Training and Technical Assistance Specialist for Safe Babies with 0 to 3. She has more than 25 years of experience serving children, youth, and families in the child welfare and juvenile justice systems. Judy has played a critical role in supporting the development of 0 to 3 Safe Babies approach, both nationally and here in Ohio. And her co-partner today is Trina Lovett. Trina is the community coordinator for Safe Babies Lucas County here in Ohio. She brings over 25 years of experience working across the lifespan in school-based and community-based settings, supporting children, family, and multidisciplinary systems. She's partnered with providers to address the social, emotional, and developmental needs of children and caregivers, and has contributed to process improvements that have strengthened coordinated systems of care while leading cross-sector collaboration among community partners. It's my pleasure to have them both here today. I know that you're in for a treat, and I will turn it over to Judy to kick us off.
Hi, everyone. Glad you can join us. I'm coming to you from Iowa, so not too far from you, just 2 doors down kind of neighbor, right? 3 doors down. And I want to thank you for joining us in this conversation about how early childhood brain development and infant mental health services impacts every facet of the work that we do in Safe Babies, in the area of intervention, prevention, all the above, right? And even post-case situations. I do want to, the first thing we want to make sure we address is like, do we fully understand the impact of the science of early childhood brain development with children ages 0 to 3? So yes, I'm gonna throw a pop quiz at you, but don't worry, we don't score it. You're the only one that's gonna score it. I would like for you to think, and I know most of you are active social workers, so I know your brain is firing by 10 a.m. A lot. I would like to take about 30 seconds, and I want you to count, just put dots on a piece of paper, count the number of things that your brain is telling you in this moment, okay? That's all you have to do is count up what you're thinking about for 30 seconds. Just tap, 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 tap. All right, ready, set, and go. Okay, how'd that feel to stop and pause for a minute? Um, I won't make you share how many, and won't put you on the spot, but I'm going to share a little bit, even for me sitting here, and thinking about all the things that was going through my mind in that 30 seconds. I was thinking about my clock downstairs dinging right now. I'm thinking about the construction that's going on outside down the road. I'm thinking about when should I tell Caitlin to switch the slides. So I have this connectivity stuff happening, neuroconnectivity stuff happening in the real at this moment. I counted up this time, I did this activity yesterday too. I counted up this time it was 17 things I thought about in that 30 seconds, right? So my brain was connecting me to different problem solving, processing, all of that stuff. So I just wanted to kind of set a stage for what we're going to talk about with infants and toddlers and their rapid brain growth and development in just the first 6 months of their life. So, Caitlin, if you can share the slide with us now. Okay, so if you look at this slide, this is one that we use that when we talk about and try to help folks understand how rapid the brain growth happens at the early stages of life and why Safe Babies focuses on children ages 0 to 3. Um, just in the first 6 months of a child's life, you can see how the baby's brain is operating. Only in those first 6 months, right? So you have like crazy fast neural connections happening every single second. 1 million new neural connections happening every second. The plasticity of the brain affords the opportunity that as the baby grows and has connections with their primary caregivers, they're starting to learn about environments, who's safe, even as young as 1 and 2 and 3 and 6 months of age, right? So when you look at the how the young baby's brain is operating and how important it is in the work that we do, that we have to make sure that we help this baby develop the architecture it needs to grow and expand on these million new neural connections that happen every second. Now, what we really need to pay attention to as we work with families of young children is not only are these neural connections happening, the neuroplasticity is happening as they do their interconnectivity. And I'm not a neuroscientist, so forgive me for not getting too deep in this. I'm talking practical here. As they start growing those neural connections, if they aren't nurtured and continue to interconnect with each other, a process happens called pruning. And you think about like pruning a tree, is if those drop off, then there's no more connection to the rest of the growth, right? So as those drop off and those aren't nurtured, then we don't have that opportunity to they don't have that opportunity to reinforce and strengthen those neural connections that we're talking about. And when we're talking about neural connections at this age, it's more about developing the foundation of that brain plasticity, and that dosage of neuroplasticity is required to foster that positive change we want to have happen with young children. Um, and we need not necessarily, the emphasis of um, therapeutic interventions, but therapeutic relationships that happen, right? So you think about who would be those people that have therapeutic relationships at this point of the baby's life. How do we nurture that? How do we support that in the world of social work, right? Because our systems don't necessarily support that. And so that's where Safe Babies comes in, is how do we get that message out there that we need to really lift up the value of nurturing that foundational framework for a child under the age of 3, right? So that's called that early plasticity. And then so it's really important for us to have those early interventions. Next slide. So now we'll talk about infant and early childhood mental health. So we like to apply what we know because that's science, right? We've learned the science of how a baby's brain grows and develops and what they need to continue to build on the the overall functioning of their development, attachment, relational learning, security, all of that stuff that matters. That's the architecture of early childhood brain development. So when we talk about in the realm of safe babies work, we want to make sure that everybody who comes in contact or interacts or engages with families of very young children, they understand this, and then they can plan and create, whether it's practices, even code, law change, any of that stuff, so that they're aware of how important that is and how important the interactions with primary caretakers are very, very important and helping nurture that, right? So knowing what we know, we utilize that and we use infant and childhood mental health as the center of the work that we do, because we know that the brain development happens so rapidly during those first 3 years of life. So, how does that period of rapid development, connect to the early childhood mental health services? So when you look at social and emotional development, and which I'm sure many of you, as if you're seeking social work CEUs, I'm sure you've had some experience in early childhood development. But what we like to focus on is that this is the bedrock, and everybody who works with these families needs to understand that this is the bedrock so that they can plan practices accordingly. And as that grows, in a healthy environment, you see the growth and development happen with the child. You see that they're eager and they're seeking out learning. But they do show when in the realm of the families that we work with, you can start seeing how that is how the risk factors truly impact the development of a child so young, right? So it might be present in developmental delays, the inconsolable crying, failing to seek comfort from their primary caregivers, and they don't have that lack of curiosity and exploration, among other different symptoms that you might see in the work that you do. And this is kind of the warning signs of maybe early mental health disorders for children. So that's kind of a flag to say, we're seeing some behaviors that may not exhibit that opportunity for them to grow and develop and attach. So those are some of those symptoms that you might see, right? As you're working with young children. And then, when you use Safe Babies, developed a framework around this so that we could always use this as the foundation and build outward and upward, at the family level, at the community level, at the larger system level, right? So our core focus is strengthening that bond to that child so that they have the opportunity to grow and get caught up on their developmental milestones that we like to see, and really realize that infant mental health is a true and genuine issue, right? So keep that in mind, and we will talk a little bit more about how it looks between a healthy development and a development that might cause us to pause and come up with alternative ways of working with the family. So if you can do the next slide. All right, so when we talk about in the context of secure and nurturing relationships, that brain, because they're not under stress factors at this moment or in their development, they're able to organize themselves around curiosity and exploration of the environment. There's nothing funner than watching a 3-month-old, start to figure out how to do things that a 3-month-old would do, right? And it's fun, and the curiosity is really neat, and it draws a lot of attention and excitement, right, for the families. So but as we shift into the families that we come in frequent contact with in the populations, then we're looking at it in the context of neglect, the volatility, disorganized relationships, and the brain organizes itself around self-preservation. We're all very familiar with, fight, flight, fawn. We're all very familiar with that. We won't have to go deep into that. But if you think about that, if that's in the context of neglect or families who are struggling with many, many different nuances in their lives, then it's really hard for them to help a child at this age to organize themselves and give them that nurturing environment. So as professionals who work with these families, we need to help support and lift up that family, those parents, the primary caregiver or the primary caregivers. We need to help lift them up. And stabilize their environment so that they can focus more on the love and the nurturing that they truly, truly want to have with their child. Next slide. Thank you. Okay. So why does this matter so much in the context of child welfare systems themselves? If you look at any state around the country, including Ohio, the average number of children under the age of 3 that enter foster care in our systems is 31%. Usually, the range in any state is usually 27 to 31%. So if you think about that, that's 1/3 of the population of children in foster care are under the age of 3. So if this kind of lays a stage about how important this is to address these needs of these families, and we have to say, are we doing our best that we can, knowing what we know about the science of early childhood brain development? We can continue, thank goodness for MRIs and being able to study this brain. And now we're talking about the science, right? We're not guessing. This is the science. This is what's happening to a baby's brain as they grow and develop. They have a healthy environment and they continue to build on the architecture and the framework of that secure, nurturing relationships early on in life, or they are experiencing very disrupted patterns in their early life. So a majority of these kids that we're dealing with, right, they have some disrupted patterns. And so we need to bring in the experts on how we can get children back into their in a stable environment and the catching up of developmental delays that we see happen in safe babies a lot, right? So every 10 minutes, a baby is removed from their parents. There's trauma number one, right? When we go back to thinking about ACEs, first trauma is easily the removal of the child. How can we set up systems where maybe we could even prevent that trauma for that child, right? Ohio's working really, really hard to figure out how to think about upstream and downstream approaches on how to meet the needs of this 31% population, maybe before a removal has to happen, or if it does, to have those prevention services in place at that time and on the ready to go, right? So when our brains grow so fast between the ages of 0 to 3, then when we can address those issues and help parents have their own stable environment themselves so that we can lift them up to be that person to help foster the growth and development in those first 3 years of life. They don't know what they don't know, and many of them come into systems or we receive them knowing that most times they have a significant number of environmental factors or their own childhood experiences that impact how they can provide this for their own children. So that's where we come into place as professionals across systems to try to lift that parent up so that they can be that person, right? So that's kind of Safe Babies in a quick nutshell. If you've maybe never heard of us, we get the wonderful opportunity to work with Ohio to see what we can do and how we can be as partnerships that eventually trickles down into the community itself, right? Let me make sure I got all my notes. Yeah, you can go to the next slide, Caitlin. All right. Micro, meso, macro. So we like this slide just because while we talk about the impact of just that direct care that we've had with families, we change practices. Um, uh, if most of you have worked in child welfare or court systems at one point or have come in contact with them, you know that that system is more compliance driven and kind of designed off criminal courts, right? It doesn't really nurture or support healthy healing for families. And so we're trying to shift the mindset and the practices to where what if we actually approach this as a health concern for our families, right? And start thinking about bigger picture change, right, for systems themselves. And so when we look at it that way, the best way that we can start advocating for this kind of change that Ohio is so deeply embedded in right now, in the three, almost four sites, right? That we need to understand that it doesn't stop at the contact with the families, because otherwise, what happens? If any of you are direct providers, think about what you're doing and you're doing your best and you're making that impact directly with the family themselves, right? But then all of a sudden your caseload increases, right? You have your capacity is like beyond what you can actually really take a deeper dive in and making true lasting change for families, right? We've all seen that. There's burnout that happens at that point, right? So, our hope is that as we figure out how to break down these silos that we all work in, because I am guilty of it as well. You put the blinders on. I just want to get through my day. I just want to get through my week. I just want to get to my paycheck. I am exhausted, right? So how do we address our own health and well-being is by working more in a team approach and how to prepare to receive families and how to prepare for families to receive us. So it doesn't stop at that family level. The partnerships of everybody that comes into contact with families and makes decisions in the care of families are critically important for us to reimagine things within the work that we do at Safe Babies, because we're on the outside, right? If I were working directly in direct care, I know that I'm going to need to figure out what it is that's blocking these families from being successful and not having to live their entire lives in a child welfare system, right? So what's out there, we know what families need, and we have to grow that. And if we can't help them get that, then what do we do? I'm just one person. How am I going to do that? And you have to think about bigger picture and casting a broader net when you really want to make that system change that ultimately trickles down and circles back and helps families. So I'm going to stop talking for just a second, and since you can put some thoughts in the chat at the micro level, uh, let's see what you come up with. At the micro level, we're talking about the influences, supporting the resiliency of families as you're working with them and reducing that siloed service prevention. What is like an area, and I know most of you are going to say housing and transportation, but what is something that within your control do you think if you found the right people, you could make real lasting change, not just for one family, but for a system of families? Just throw them in the chat. One thing, one issue that you see pop up with families that you might come in contact with. Listening, childcare. Ooh, childcare. Lack of quality daycare, co-sleeping, housing. They're going fast, so that's why I'm just catching some of them. Yeah, so what we try to do in all of this, I'm going to jump in the area of mental health and childcare, uh, co-parenting with resource parents that if they developed a relationship with the birth parents, that can have such a huge influence on these young children. Some of the simple practices that don't take giant system change is how can we connect those two primary caretakers or three or four primary caretakers to help lift up the development of the child and the security and the growth of the child. One simple way that we've done it in Safe Babies is we developed a 2-for-2 book program, and I'm sure some of you may have heard about it. It's simple and it's easy to implement, and you're creating that great family change. You're creating an intervention that doesn't cost a lot of money, but it's nurturing early literacy. It's nurturing the attachment and the bonding that we know is very, very important in those critical ages, right? So we came together and partnered with a few people that maybe had access to the books that we needed. So the 2-for-2 book program is um, whether it's you come to a family if a child is placed in another home where they're not with their birth parents all of the time. 2-for-2 book program is easy. The parents get a copy of the book. The primary caretaker for that child gets another copy of the book, and there's opportunities to read it like that consistent time every day where the parent can sit down, whether they're holding the child, and read that book to them and talk about the pictures, and touch it, do all of that important sensory motivation that happens. And then at the same time, if they're not with that parent, they can arrange to read that book while the resource parent is holding them in their lap. And you see how that interconnectivity is happening and all that neurological stuff that we want to have growth in a young child like that. So they start to figure out where their comfort and security is just in that simple task alone. It doesn't cost a lot of money. You can get books donated all the time if you're interested in kind of just, we have a one pager that shows you how that operates. But it makes a huge impact on the mental health of the child and the parents themselves, right? So you look at that, that's kind of a micro level change. And then if the meso level change, when we want to make these kind of changes, we need each other, right? This is where we got to break down the silos and really start becoming thought partners with each other on how we can make bigger changes that may be out of our individual control. And Trina's going to talk a little bit about that and how they address that in their own community. So I'm not going to spend a whole lot of time talking about that, but we need groups of people to come together. It's also good for our mental health. So that we feel like we're not doing this alone, right? And bring people together because I am not an expert in early childhood development, and I am not an expert in community organization. I am not an expert in many things that Safe Babies is. But what I do claim to be an expert of is I will find the people who are the experts so that I can bring them together in community and around the table so that we can make these kind of changes, including parent leaders and people with lived experiences. And then you talk about that macro level. If feels so much bigger than the group that you're forming and putting together, if it's that big, what are those cross-sector systems? What are the policies or the laws or the legislation that needs to change? We need a bigger lift. Who are our partners to create that bigger lift and start discussing amongst yourselves on how that looks for you in your, first of all, your community environment, your neighborhoods. How can that look for you in your state structure? And how does it look across the country even? Is the, how big is the issue that we need to address? Poverty is obviously one of them, right? Housing, it's all different. It's all in different levels no matter where you work, but in your own community, you're the expert in knowing what your priorities are. So I just wanted to share that a little bit that you can do the next slide, Caitlin. It's never just me working with a family and then working with the next family and working with the next family. It's using these partnerships and the people who are the experts in this in order to prevent further harm that could happen with children because we're working so fast and we're so deeply entrenched and just putting out the fires, right? And going on to the next case. If we work together as a collective body to come up with plans and opportunities to create those interventions that you need as an individual, and they're there and they're on the ready for you, then it makes it easier for you to implement it with direct work with families as well. I wanted to, before I pass it over to Trina, I wanted to talk about the many definitional tools in the Safe Babies work that we do that's on our website. I think while Trina's talking, I'll see if I can drop a link to our website into the chat. Just shop around, explore. Many of these are available to you, and they're very easy to access to say, oh, wait, I want to learn more about what Trina's about to talk about is the active community teams in communities with this Safe Babies work that is happening. So I appreciate you listening to me for a while, and I hope the work that you do continues to fill your soul. Trina.
Thanks, Judy. Good morning, everyone. So I'm going to build off a little bit about what Judy shared. I'll be talking about partnerships and cross-system collaboration. I'm going to walk through what this looks like at the community level, specifically how we're using cross-system collaboration in Lucas County to support young children and families. Next slide, please. In early childhood development, it doesn't happen in isolation. It happens within relationships and within the systems that support families. Families are often interacting with multiple systems at the same time: healthcare, early childhood, behavioral health, and sometimes child welfare. You can just think of if you have a baby that's born premature and all of the different systems that are going to be involved in that baby's life. Each of those systems may be working well on their own, but they're not always working together. And when that happens, families can experience gaps, whether that's delays, confusion, or difficulty accessing services. How systems work together directly impacts whether families are able to access support early. And as Judy was stating, so much happens in the first 6 months of a child's life. So it's very important to get those services in as early as possible. So what I'm going to walk through is what this looks like in Lucas County and how we're approaching this through our active community team. Next slide, please. So just a brief overview of the active community team. We refer to it as ACT for short. The active community team is how we bring systems together intentionally with a focus on prevention and early supports for infants and toddlers. Our aim is to not have those babies go into the child welfare system at this time. ACT is not a program, it's a space for collaboration. Safe Babies facilitates that space, and partners come together consistently. Specifically in Lucas County, we come together bi-monthly, and we talk through what's happening across our systems. Partners share updates on their programs, whether those changes are positive, whether they're challenging, and that keeps every early childhood community informed and up to date on available services in our community. Another key part of this work is improving how referrals happen, making sure providers know how to connect families more effectively. Over time, this leads to systems functioning in a more connected way, rather than working in silos. I think Judy mentioned silos a lot in her presentation, and I'll probably be using it a lot in mine, because what's very important is relationships in a community. An example of this is how coordination across agencies can lead to new partnerships. Through the active community team, agencies are able to work together to better serve families. For an example, in one case, a gap in services was identified and a fellow ACT partner was able to step in and offer services and classes to fill that gap. As a result, those agencies developed a partnership that now benefits both the families they serve and the agencies themselves. This is a good example of how coordination doesn't just improve communication, it can lead to more responsive services for families. Next slide, please. So who's at the table? In Lucas County, we have an array of providers. As you see on the slide, there are only a couple of those that are attending our meeting on a regular basis, consistently. In Lucas County, our active community team includes partners like 211, Children's Services, Help Me Grow, Early Head Start, infant and early childhood mental health providers such as Ohio Guidestone, Harbor, Unison. We have substance and addiction and recovery agencies that are on our team, along with healthcare and other community organizations. Now, the specific agencies may look different in your community, but the systems are usually the same. What really matters is having the right mix of partners at the table, not just those who serve families, but those who can make decisions or influence access to needed services. That means not just having caseworkers, but the supervisors, the managers, and directors. So it's imperative to have people who can voice what's happening in the community, who can also make changes to policies, make changes to processes in their own agencies so that you all can be able to collaborate as one system. Our partners are really the reason the active community team works. We're always looking for members who can best support the 0 to 3 population and bring something meaningful to the table. One example that I have is our new connection with the area of Office on Aging, becoming a part of our active community team. They may not initially seem like a typical early childhood partner since their focus is on older adults. But if you think about it, they often work with kinship caregivers, like grandparents raising young children, or visiting intergenerational households where there may be infants and toddlers with needs that have not been identified. Because they're becoming part of the active community team, they will have the opportunity of a better understanding of early childhood systems and more defined referral pathways to connect their families for supportive services. This is a good example of how having the right partners at the table, even those you may not expect, can expand how we identify needs and connect families to services earlier. Once you have the right partners at the table, the next step is how you actually work together, which is where we started, focusing on how needs are being addressed locally. Next slide, please. In Lucas County, we started with resource mapping, just understanding what services exist in the community. I know a lot of communities will say, we already have a directory, we have 211, so why are we doing this? Why do we need to do this? But resource mapping goes really beyond just having a list of services. Over time, with resource mapping, this work is shifting into asset building, which is really understanding how those resources function and how they can be better connected. It's one thing to know a service exists, but it's another to know how to actually connect a family to it. It's like telling a parent, call SpongeBob Mental Health Services because your baby's behaviors, you don't feel like they are what they should be. But you don't know what SpongeBob mental health services offers. You don't know if they have a waiting list. You don't know if that parent is eligible. So being a part of our active community team and going through this resource mapping, we're diving into exactly what does that agency offer? What's the eligibility? What's the criteria? What's the age? How long is the program? So having partners in the same space allows for real-time clarification and problem solving, especially when it comes to referrals. In Lucas County, one of our biggest strategies has been offering universal training across the community and systems. Now, the goal is to make sure providers are receiving the same information, so systems aren't operating with different levels of understanding. In different agencies, you may have an agency A offers trauma to their staff, agent B offers trauma training to their staff, but they may be offering different programs. I know I've been at different agencies, and each agency's training was a little bit different. But with Safe Babies in Lucas County, we are offering universal training. So everyone in the early childhood systems has an opportunity to gain the same knowledge base because we are serving the same clients. We also host a fall conference focused on early childhood trauma, specifically for ages 0 to 3. We're also offering fetal alcohol syndrome disorder training 101 for both providers and the broader community. That means parents are welcome to all of our trainings, so they get the same information that the providers are receiving. And our training for FASD is in partnership with one of our ACT members. And we've also created a space for agencies to train and share what services they actually offer. So this means providers better understand each other's processes, especially intake processes, and how to make effective referrals. And you may ask, so why does this matter? Because this reduces misinformation, confusion, and unnecessary barriers for families. When providers have a shared understanding of development, trauma, and available services, it leads to more consistent and effective support for our families. This is how we begin to reduce system barriers and make services easier to navigate, not by adding more services, but by improving how we use what already exists in our community. Next slide, please. So there are things we've heard from infant and early childhood mental health providers and partners in our active community team. I'm sure most of you all have heard these also. One thing we've learned is that capacity can vary across providers. Some providers may have wait lists, while others may have openings, and that's not always visible across systems if you are not connected to each other. Families are also often interacting with multiple systems at the same time. I think you can just think about if you have a family, especially if they're already involved in the child welfare system, how many service providers that may be in their life: medical, mental health, addiction, the court system. And if you think about it, when I was in the field, something that the parents always could not remember who they talked to because they didn't ask who they talked to. They didn't ask, oh, can I have a card? So that can create complexity when those systems aren't fully connected. For example, a family may be connected to their pediatrician for developmental concerns, referred to an early childhood program, and also trying to access behavioral health support at the same time. Without coordination, they may be making multiple calls and repeating their story over and over and still not getting connected in the correct way. And that's where coordination across systems makes a difference. We also hear about barriers such as transportation, funding, and eligibility. We've recognized that there can be differences in how early childhood needs are understood across systems. And that's one of the reasons we focus on shared training across the community. Also, there's a continuing need for relationship-based interventions like CPP. And these themes help us understand where coordination can be strengthened and where systems can better support one another. Next slide, please. So, the active community team in practice. How does it look? This is where we started to see how small changes in coordination can make a difference. And I'll show that through this quick example. Some providers have wait lists, as we mentioned before, while others may have openings. But that's not always visible across systems. A good example of where there was an opportunity for collaboration is around child-parent psychotherapy. And this was an identified need locally, and Safe Babies Ohio supported efforts to expand access by helping providers receive the training needed to offer CPP to families. And within this, the providers were in the same cohort, so they received the same information together. So through their collaboration, the infant and early childhood mental health providers are finding ways to work through system barriers and better support families. So what that looks like in practice is providers communicating more directly with each other. Instead of referrals happening in isolation, providers are communicating with each other. This has led to better matching for referrals. So if one provider has a wait list and another has openings, families can be connected more efficiently. These are small shifts, but they make a meaningful difference in how systems function. Next slide, please. So why does system level work matter? Families don't experience child welfare, healthcare, and early childhood services as separate systems. They experience whether or not they can get what they need and how easy or how difficult that process is. Another example, a family isn't thinking, I need to navigate 3 different systems. They're thinking, my child needs help. Where do I go? And if those systems aren't connected, they may be making multiple calls, repeating their story, or not getting connected at all. Families don't see systems. They experience access or barriers to access. And that depends on how well those systems in your community are working together. Many of the challenges we see don't come from one system. They happen in the space between the systems. You know those lines of who dropped the ball scenarios when your client doesn't get services? Those are the gaps in the system. You sent them to the court system. You sent them to child support enforcement. You sent them to mental health, but they didn't get any services at all. It's because the systems have not been connected. And when coordination improves, even in small ways, it can make a real difference in how quickly families are able to access support. For infants and toddlers, that timing matters. As Judy said, so much happens in the first 6 months. Early connection can influence long-term outcomes. Safe Babies Ohio helps support that coordination by bringing partners together, building shared understanding, and creating space for ongoing communication. When systems are more connected, it reduces the burden on families to navigate services on their own and allows systems to work together in a way that better supports families. And thank you for your time today, and I appreciate the space to share what we're doing in Lucas County.
Thank you, Trina. Thank you, Judy, for sharing your insights and your expertise. I am going to take the last 10 minutes that we have here with our audience and just share a couple more contextual things about what's going on with safe babies in other areas of the state. And so you heard from Judy, who's got that national perspective and is our technical assistance provider for the Safe Babies programs that are happening here in Ohio. And I and my colleague Dominique Johnson support the expansion and the strategic advancement of the Safe Babies work that's happening in these communities currently. So we have programs in Lucas County, you heard from Trina. We also have programs in Scioto County, down in southern Appalachian, Ohio, right here in my backyard, Franklin County, as well as up in Cuyahoga County. So the Safe Babies work is reaching families and communities across the state. And each of these communities, you see that they're geographically diverse, and they were chosen initially for pilot sites to be to bring this approach into these communities based on the unique needs in these communities and the needs of families, and specifically the needs of infants and toddlers. From the Groundwork Ohio perspective, we provide the statewide coordination for these efforts that are happening locally. And so you've heard a lot about the importance of systems work, both at the mezzo and macro level. Groundwork Ohio's role is more at the macro level. And so us having this bird's eye view of what's going on around the state, my colleague Dominique and I are hearing often from our colleagues like Trina and the community coordinators in the other communities who are reporting up their successes, their challenges. Dominique and I at Groundwork Ohio are learning from these, creating also additional statewide stakeholder groups through our statewide advisory group. There is more information on our website if you'd like to learn more about that group and get involved. But we're looking for ways to expand advocacy and to enable parents and family experiences and the experiences of community coordinators and the needs of communities to be elevated up to our systems and decision makers to make improvements in policy, in investment, and where there are opportunities to improve practice for young children and families that are either at risk of or are currently involved in the child welfare system in Ohio. Okay, now this is the moment of truth. This is where we find out if I shared my screen correctly and whether or not you have sound. So let's give this a shot.
I think the theme of Safe Babies is like, it takes a village to raise a child, and a lot of people don't have that village. There's a lot that goes into our work. A lot of times the services that families can access operate in very distinct silos. You might be able to get connected with a mental health provider for yourself. You might be able to get connected with an early intervention provider to help with your child's behaviors. You might be able to get connected with a substance use treatment provider. But all of those providers are operating in silos. So what Safe Babies tries to do is bring everybody to the table together and look at each family's situation in a really holistic way and work together collaboratively, and we can get a lot done a lot more quickly when we take that approach.
Having that flexible and responsive support system is really helpful to creating both a system for the family to be successful that's different than another family needs, but also I think it creates bridges between the existing systems.
The workload definitely does get easier when we have programs and partners like Safe Babies to fill in for where we just physically cannot.
Substance use has impacted Scioto County tremendously. When we provide support like the Safe Babies program has provided to multiple clients that I have worked with in the past, then we can keep families together, safe, and that is what everybody wants in the community.
What I love about the Safe Babies program is the concept that this is not just a problem. This is a community problem. And how do you solve problems? By bringing the whole community together. And that's part of the Safe Baby model, is to bring your community and your shared holders and your partners and the family and the kids all together when you're deciding that you're going to take on a challenge like this.
I feel like I wouldn't be where I'm at today if it wasn't for them. I feel like I would still be struggling and I would still be in the same position begging for help with everything in my daily life if it wasn't for them.
You know, the work of helping families and young children stay with their families and grow together. We all deserve that, they all deserve that, and anything we can do to make that difference is the right thing to do.
Okay, so I share that video because it shows and exemplifies work with our partners and other stakeholders throughout the state where Safe Babies is reaching families and communities. And I also want to note, I saw a really great question in the chat about plans for scaling this approach. So yes, we have geographically diverse regions of the state represented currently. I will note that the Safe Babies work is funded federally through HRSA. And Groundwork Ohio, my colleague Dominique, we are leading conversations right now about sustainability and sustainability planning for this work. And, you know, it's more than dollars and cents. We're thinking about this more holistically. It's also about the partnerships and creating additional opportunities for community partnerships like those that have been built already to continue to flourish, as well as to set a foundation to provide technical assistance, resources, share our learnings with other communities that are interested in creating a wider table to wrap around and to support families and young children that are, again, in the child welfare system or currently at risk of involvement with the child welfare system. So while we don't have a plan currently to scale to all communities, I want to challenge you to think about it as a philosophy of care and a philosophy of community support in addition to just the actual direct work with families. So I put this QR code here because if you are interested in learning more about the work that Groundwork Ohio is doing to support the Safe Babies work, please feel free to visit our website. If you're watching this webinar from your phone, you're not able to access that QR code. It is at groundworkohio.org/safe-babies-ohio. And thank you all. I've seen some really great comments come through the chat. I really appreciate that and appreciate that I'm seeing folks saying that there is a huge need. And as a Lucas County, being in Lucas County and having worked with caregivers having trouble getting access for young children with mental health appointments. Someone is asking how they can get over this hurdle. So we have your information, but in the last couple of minutes here, I'm wondering if I can put you on the spot, Trina, if you have a response to that, or if there is a good way for this individual to connect young children with mental health providers in the Lucas County area.
Of course, we have several agencies in Lucas County that serve early, childhood mental health. So I've got her email address. So I'll be contacting her to kind of find out exactly what services she needs for them and their ages to connect her with some of our partners.
That's wonderful. Thank you, Trina. I appreciate that. And thank you so much for the question. I'm seeing another person that has a similar question in Stark. And if you don't mind placing your email address in the chat, we'd be happy to provide additional support where we can or connect you with other partners. I've also seen some questions from folks about how they can get involved. So while the Safe Babies program is not currently hiring for full-time or part-time workers, we do have at the state level through Groundwork Ohio, we do have opportunities to get actively involved through our statewide advisory group. We are seeking new members that are interested at that state level or can be embedded in communities, but interested in helping to build the system and to build the roadmap for strong system collaboration. Feel free to, again, visit this Safe Babies Ohio website, check out the QR code there, and you can see some more information about our state advisory group, and we're happy to share some more information with you if you reach out to us afterward. And so that will bring our presentation to a close, and I will also ask my colleagues if you would please drop the link to the session evaluation in the chat. I've included a QR code here as well. If that's just as easy for you to open up, please feel free to do that. But my colleagues are going to share the session evaluation here. I mentioned this at the top, but for the one free social work CEU, please fill out this evaluation. We will have to verify that you attended the session for the entirety of the session, and then you will hear back from us with a certificate of completion that you can then upload to CE Broker. I'll leave this here for just a moment. And before we officially close, I have a couple other announcements from Groundwork Ohio, including one advocacy alert that we currently have active. And the advocacy alert, I'm going to move forward, but if somebody objects, please, you just speak up in the chat and I'll go backwards. But feel free to fill this out. We are asking Congress, as they're beginning to work on fiscal year 2027 funding decisions that will shape early childhood programs for families across Ohio and the nation. We make it so easy for you here at Groundwork Ohio. You can check out this QR code, go to the link, and easily send a message to the representatives and members of Congress who represent you and will be making these important decisions at the federal level. In addition, things that you can do right here at home. We are leading a nonpartisan voter engagement effort to ensure that Ohio's families and community members are encouraged to vote in the upcoming primary election on May 5th, 2026. And we know that young children can't vote, but the adults who care for them can. And we ask you all to make a plan to vote. Feel free to share this information with your networks as well. We'll be going on the road soon. Later this year, late summer, we will be visiting all 32 Senate districts in Ohio, and we would love to partner with you, would love to talk with you about what this could look like to bring Groundwork Ohio to your community as we are building a roadmap for our policy agenda moving forward into the next biennial state budget. And finally, we have lots of resources on our website, research and reports, the latest data of how young children in Ohio are faring. You can find that here again at our QR code or on our website, www.groundworkohio.org/resources. And that does conclude our webinar today. I want to thank Judy and Trina again for the generosity of your time, your wisdom, your expertise. Thank you so much for sharing all of the wonderful work that you are doing. Thank you all for joining us this morning. And yes, where's the link for the CEUs? I'll go backwards and I'll ask my colleagues again to please drop that in the chat. I will leave the webinar open for another minute or so that folks can grab that. Don't want to leave anybody in a lurch. Thank you all so much. This does conclude our presentation, and so you are welcome to depart when you're ready. I'm just going to leave this here for just another moment so that folks can make sure to grab that CEU session evaluation. And thank you so much. Have a great day, everyone. Appreciate your time.